I am joined today with Dr. Grimaldi, an orthopedic and spine specialist here at MUSC, to learn a little bit more about what he does. Thanks for being here.
Thank you, Abigail, for having me.
Yeah, absolutely. So you are new to the Columbia area. Can you give me a little bit of background on just sort of your experience as a medical professional?
Sure. So I was originally trained in Pennsylvania, and from Pennsylvania I moved to Tennessee. I practiced there for 17 years. There I did spine surgery and all general orthopedics. I was in a rural area outside of Knoxville, so there was a big need, and I was able to continue to do general orthopedics with my spine surgeries. And after being there for 17 years, my family and I just decided to move to South Carolina.
So lots of people experience back pain, like you were saying. I'm sure so many of our viewers experience back pain. It's all too common, regardless of age, gender. It's just, I feel like it's kind of all over the map. When is it time to go and see a professional?
Sure. So when you're having back pain that's going on, that's severe, that's when you should go and see a professional. Or if you have back pain that's just continual and you're just not sure what's going on. Quite frankly, if you're just concerned, you have nothing to lose by going to the doctor and have them check you out and give you an A-OK, or just tell you there's other things that we need to look into.
Yeah, absolutely. I think too, surgery is scary. It's scary for people to think about back surgery or knee replacements and hip replacements and all of those things. But we were talking before cameras were rolling, there is a ton of options for treatment and preventative measures that don't involve surgery.
Sure. So yeah, I don't want you to think that if you're coming to my office that you're going to have surgery. I actually operate on a very small percentage of the people that I see. The majority of things can be treated conservatively. So when we treat things conservatively, the most important thing is try to find what the problem is. Once we know what the problem is, through history and physical exam, we can treat it with anti-inflammatories, physical therapy. If we need to get more aggressive, we can do injections. And if we need to get more studies, MRIs can be obtained, different types of studies to help with the diagnosis and determine which path we're going to go. If you fail conservative treatment, you still don't have to do surgery. It's a matter of understanding, is this a problem you can live with? Or is it something that's severe enough that you would rather just have surgical intervention?
Yeah. Wow, okay, good to know, good to know. Surgery doesn't always have to be so scary.
Yeah, that's right.
So we talked about back pain. Let's go to joint pain. I feel like that's pretty common too. When is it time to see someone if you feel like you're having joint pain?
Yeah, it's really the same thing. I mean, if you're at home and you try over-the-counter anti-inflammatories and things aren't getting better, a lot of people come to see me because they just have concerns that something's happening, or they had an acute injury and they're really concerned. If it's hurting them real bad, they'll come to my office and then I'll see them and get them evaluated. But there's no problem that's too small. So if it was just a little twist and they're just scared that they might think they torn a meniscus, they can come on in, we'll evaluate them and give them a better idea of what's going on and let them know if we need to get more aggressive in the treatment or not.
Yeah, better to be safe than sorry.
That's right.
Going back to back pain, the SI joint is something that can kind of be a hidden cause for that. Can you tell me a little bit more about that?
Sure. So the SI joint is the sacroiliac joint. And it's a tough joint to diagnose. We diagnose this through multiple ways. One, the person's history, the physical exam helps, and then we also do these diagnostic injections where we inject some numbing medicine into the spot. If they feel 80–90% better after that injection, then we can pretty confidently say it's the SI joint.
Wow.
Sometimes the SI joint is a joint of exclusion, meaning we want to rule other things out first, like is it coming from the back or is it coming from the hip? All these regions. So the SI joint, the sacroiliac joint, is down in the pelvis here. So sometimes you're not sure if it's your hip, is it your back? It's kind of in the middle.
Interesting.
Yeah.
Spinal compression fractures. That is a lot. I don't even know what that means.
Okay.
Tell me what a spinal compression fracture is.
So that's actually very common. I see a lot of patients with spinal compression fractures. Usually the elderly population, they have osteoporosis, which is weakness of the bone, and they can break a bone in their back sometimes just by sneezing. But when that pain lingers, that's when I want them to come and see me right away, because I'll repeat the x-ray, and if I see a little compression of the vertebrae, which is the bone in the back, that's a sign that there's a compression fracture. There's also a procedure that is minimally invasive. It's called kyphoplasty. And it's just a small little poke hole that we make in the back. It takes really 10 minutes to do the procedure, and people notice improvement right away. That we put a little bit, we call it cement, inside the bone to support the bone.
Wow.
People notice improvement right away. Sometimes without the procedure, people are feeling the pain for a couple of months until that bone heals. And sometimes when that bone heals, it heals in a compressed position, and that's when you kind of see these pictures of these little old ladies hunched over like that.
Absolutely.
So, but we also want to make sure we treat osteoporosis because that's going to help prevent these fractures again in the future.
Yeah, it's hard to believe that something like a cough or a sneeze could create something like that.
Well, when your bones get weak, little things like that can happen.
Yeah. Is there anything else you want people to know about the work that you do, or anything in that realm?
Yeah, well, I think, where I came from, I was able to focus on everything from the neck all the way down. So when a patient comes to see me, if they had pain in their back, and I say it's not your back, it's your hip, it's something that I'm able to take care of. So I'm able to help the person from their neck down to their feet. They don't have to go see multiple doctors. If they prefer to see different specialists on everything, and I feel that's in their best interest, I'm more than happy to refer them. But it's one of those things, if they come in, I'm happy to see them for multiple different problems and try to get their pain relieved.
Fantastic. Well, thank you so much for being here and chatting with us about this. And we're going to have office details, office hours, and how you can schedule an appointment if this is something that you're dealing with on our website. We'll be right back. Thank you so much.
Thank you.